Let me walk you through our COVID campus dashboard. Our goal is to keep you informed about cases and testing results, and we've also created an infographic representation of cases and transmission rates in the Des Moines metro area that aren't readily available elsewhere. In the top table titled GV COVID cases, new cases are those identified in the previous week. In this case, that was the week that started on August 24th, the first day of classes, and ended on August 28th. 3 new cases were identified last week, including 2 who are our first instances of on-campus transmission. Of the 3 new cases, in the first row of the table, 1 was a student exposed off-campus, and the other 2 were apparently infected by close contact with the first student. Those 2 are also in the second row. We had a total of 8 positive cases that were acquired off-campus, the 7 original cases I'll explain in a moment, plus the 1 new case, and could have in principle infected the 2 on campus. So we're reporting an implied campus transmission rate of 2 divided by 8, or 0.25. The only current active cases are the 3 that were identified last week, and they are included in the total to date. That total to date includes 1 staff member who was tested off campus. In the second section of the dashboard, we report the results of on-campus testing. We began testing student athletes and some faculty and staff members, mostly coaches and some of the people who worked with students at commencement, earlier in August. Those tests revealed 7 positive cases among the students and none among the faculty and staff members. Those 7 students have now completed their isolation periods uneventfully and are no longer considered active cases. The student with the inconclusive result was retested. 1 student and 1 faculty or staff member tested positive because they had been sick with COVID earlier in the summer. They had fully recovered, but after recovery, individuals still have enough coronavirus to test positive. Studies have shown that in post-recovery cases, the remaining coronavirus is non-viable. Of the total 535 tests administered on campus since early August, 69 were administered last week, and we're going to show you weekly results in the GV campus testing results section of the dashboard. While we are reporting test results in the interest of transparency, it's important for you to know that testing is a lagging indicator of infection. Infection will not result in a positive test result for at least 3 days, and because symptoms may not appear even later than that, if at all, it's entirely possible for someone to be infected without knowing that they are. It's good that the number of positive tests so far has been very low, but that's not a reason for lowering our guard. We still need to wear our masks, keep our distance from one another, wash or sanitize our hands frequently, and monitor our symptoms. In the graphic at the bottom, we show information for the Des Moines metro area, Dallas, Polk, and Warren counties, with a total population of about 635,000. In the graphic at the bottom, we show information for the Des Moines metro area, Dallas, Polk, and Warren counties, with a total population of about 635,000. The daily case count for the 3 counties is displayed as a blue column, and that count is represented as the percentage of the total population reported to be infected on that date. The orange line is a simple, smooth representation of the daily counts so we can more readily see the trends in the data. Use the left-hand axis for the daily counts. Prior to August 28th, the Iowa Department of Public Health only reported the results of PCR tests, which identify the coronavirus's genetic material. Starting on the 28th, IDPH began including the results of antigen tests, which detect proteins on the surface of the virus. Adding those results caused a large jump in the daily count for the 28th, but after the 28th, daily cases are back in the range of prior dates, but still elevated somewhat because of the new source of test data. It will take several days at least for us to learn what the new pattern of daily case reporting will look like. It's important to understand that these cases were present prior to the 28th. They just aren't included in the daily case count because they weren't reported systematically. The dashed green line shows the transmission rate in the community. Use the right-hand axis for these data. Each day's reported value is a 14-day weighted average and can only be calculated retrospectively. This is the number President Henning used in one of his town hall presentations when explaining that one of the goals of our pandemic game plan is to reduce the spread of the virus. A transmission rate equal to 1 means that one infected person spreads the virus to another person, while a transmission rate of 2, which we have not experienced, means that one infected person spreads the virus to 2 other people. Rates greater than 1 mean the infection is spreading, and rates less than 1 mean that fewer people are getting infected. These rates will also be influenced by the new reporting of antigen testing, and again, it will take a while for us to understand the new pattern. We intend to send an updated dashboard weekly, probably on Tuesdays or Wednesdays, to allow time to enter the data from the previous week. I hope seeing these data gives you some confidence that we're monitoring the situation carefully and that we're able to make adjustments to our pandemic game plan as circumstances may require.